With the cost of health care, the access to it, key issues for Tennesseans, Governor Bill Lee says he is already trying to address it with federal officials. Welcome into News Channel 11 now at 5:30. I'm Josh Smith.
And I'm Sarah Diamond. State Capitol Newsroom reporter Chris Bungard tells us the governor has been supportive of a bill that could lead to changes for the program, providing health care for 1.3 million Tennesseans, but he hinted at other options as well.
There were a lot of questions for the governor about his support for the bill that would fundamentally change the way TennCare is funded.
My greatest concern is that we address the failure of our system to address rising costs.
Would one lump sum of money, a block grant yearly from the federal government to Tennessee, be an answer? Right now, Washington pays about 2/3 of funding the state's $12 billion Medicaid program, TennCare, that covers 1.3 million Tennesseans.
If a block grant were such that we can tap it and provide more access, more coverage, more opportunities for folks to have access to coverage, then we'll do it. If not, then it won't be a good deal for Tennesseans.
Determining a good deal is complex and time-consuming, but the governor said he's already talking options with CMS, the Federal Centers for Medicare and Medicaid Services.
And I have actually talked with the folks at CMS to start a dialogue. It will take clearly months to understand even what might be available.
As the governor ponders health care options, the minority Democrats continue to say billions in federal funds are available to expand access and lower costs to TennCare through the Affordable Care Act.
I hope he considers it and does it this very session, but I'm sure he's cognizant he and the members of his own party in the legislature has unfortunately a huge obstacle to positive change.
All this comes as the committee looking at the TennCare block grant bill did not take up the measure Wednesday. With discussion of the TennCare block grant bill postponed a week, it's clear its passage is not going to be a quick one. Reporting from the state capitol, Chris Bungard.
Democrats say they have met with Governor Lee urging him to expand Medicaid with the available federal money.